Well, everybody, good afternoon and welcome to the first COVID-19 CommunityResources.com town hall meeting powered by the Center for Closing the Health Gap. I'm your moderator, your newest city council member, Michele Lemon Kearney. We know everybody has a lot of concerns. So as I said earlier before we started, this is only the first of several town hall meetings where you can get information, ask questions, get answers, and share your concerns. We're trying to keep each meeting to about an hour, so we'll have different groups of partners from the COVID-19 CommunityResources.com collaboration at each meeting, so you'll have a chance to talk to everybody. Two quick points about our website and our group. The purpose of it is to give the Black community a place to go to get information from many groups, all of whom will link you to on this one site. And all groups that serve the Black community are invited to join. This is an inclusive website, inclusive collaboration. We want everybody involved. We're all in this war together, and we are going to win this war. Before I introduce the panelists, let me just make a few housekeeping points for you. First of all, I want everyone to know each session is being recorded so that we can share it later. If you have a question and you're joining us on Zoom, look down, you'll see the Q&A. And all you have to do is go into that Q&A, type in your question. If there's a certain panelist that you want to answer, please give that panelist's name. You don't have to choose a panelist. We'd love to have your name and your neighborhood, but that's totally optional. Okay, so now let me introduce the panelists. And panelists, just kind of wave as I say your name so everyone knows who you are. Although I guess John has everybody's name there, but okay, I guess you don't need to do that. All right, and then after each panelist, let me introduce everybody, and then each panelist will give a few opening remarks, and after that, we're going to open it up for questions from you. Okay, so let me start with our Cincinnati Health Commissioner, Dr. Melba Moore. Interact for Health President, Dr. Odell Owens is on the way. Well, he's here logging in, so you'll see him in a minute. Urban League of Greater Southwest Ohio President Eddie Cohen is here. NAACP spokesperson and executive committee member Teresa Harper is here. African American Chamber of Commerce President Eric Kearney is here. Cincinnati Medical Association President Dr. Roosevelt Walker is here. I love the way everybody's waving. That's so great. And the Health Gap President, Renee Mahaffey Harris. Okay. All right. Let's start with introductory remarks. Everybody has 2 to 3 minutes to kind of give your message. And let's start with Dr. Melba Moore, our Cincinnati Health Commissioner.
Good afternoon, everyone, and just thank you to the moderator, Councilwoman, and to all the panelists, and especially to Renee for inviting me to be a part of this. I am honored always whenever I am asked to speak with my community and talk about issues that are very important to all of us, and especially this one issue that we're faced today has just resounding impact on our community. As you've heard, I am the Cincinnati Health Commissioner, and I hope to be able to impart just a little bit of information today that will clear up as much of the anxiety that many and all of us are experiencing. This is unprecedented. These are unprecedented times, and hard decisions are being made, and this is truly an event that requires all of us to work collaboratively together. So I'm open to listening and hearing from others. And again, thank you so much for asking me to be a part of this.
Thank you. Thank you. Okay. So we'll get back with Dr. Owens. Next, let's hear from Urban League of Greater Southwest Ohio President Eddie Cohen.
Hello, thanks so much for having me here. I will try to be brief so we can have more questions from the audience. I think about the times in which we living right now. So before the coronavirus, only or less than 1 out of 5 African Americans are able to work from home. So we know about this concept of social distancing. It is not created equal, and it is a privilege to have social distancing. Before the corona, by 2030, 44% of our jobs were in danger of being eliminated by automation, right? Before this, we had a digital divide. So we find ourselves, our staff is asking, what is next? How do we concretize the love, the action, and the policy that we need to do? We've seen the numbers. African Americans in some reports 7 times more likely to contract the virus. 30 days ago, it was, we can't get the corona. Now it's, do you have the Rona? So we are really doing a lot of things, thinking about how do we service these 18,000 people that we help a year. We have moved completely digital. We are still open. For folks who want to contact us, they can still call our phone number. It's easier to text. You can text Urban League, one word, to 797979. Someone will respond to you after you have text that number. We'll be having the first digital job fair announced here in the next couple of weeks. And if you go to our Facebook page, you'll see that, or our Instagram or any of our other platforms, we've launched a campaign called Corona 101. We kicked it off with Dr. Lofgren at UC Health to really myth bust, to talk about the truths and the honest issues around the virus in itself. The next week, we work with our business and development division to talk about PPE, which is the Paycheck Protection Program. We are helping folks navigate that piece. This last Friday, we did something around mental health, having to stay at home. And next week, we'll be covering homeschooling. The week after that, we will talk to folks who are actually living with the coronavirus. So our website has all the resources, ulgso.org/COVID-19. And what's so funny is just the interesting partnerships that have kind of coalesced around this. We were just on the call with Women Helping Women. Violence is an issue in our community, particularly women of color, with folks being out of jobs and stress levels being high. So we're figuring out a secret code word where they can subscribe to Urban League with a partnership with them and Meals on Wheels, so we can really get services to folks that need. We are partnering with the Rec Center to get Rec-to-Go kits in our community outreach. We know we can't do this ourselves. We need a coalition of the willing, from funders to community organizers. So we're just ready to help.
Oh, thank you so much. Okay, next let's go to NAACP spokesperson and executive committee member, Teresa Harper.
Hi, thank you for having me, Jan. Wish it wasn't televised, but that's okay. I have been involved with the NAACP all my life. I've been active in a leadership role for the past 16 years. The mission of the NAACP is to eliminate racism and to fight for equal rights for everyone, politically, economically, socially, and through education. We have, the NAACP is composed of all volunteers. So none of us get paid. There are several different committees that focus on different issues within our communities: education, health, criminal justice, juvenile justice, armed forces, labor and industry, membership, youth in college. We have several different youth programs, youth in college, which focus on developing future leadership. AACC, which is an academic and talent enrichment program for high school students. Our priorities throughout the year always includes getting out the vote. That is one way that we can actually affect change in our community. And as I mentioned, that voting is taking place right now. The only way that we can vote this time is by mail. But the thing is, to vote by mail, you have to request an absentee ballot. You can call your board of election to request a ballot, or as you're shopping at Kroger's, the applications are made available there. But you must call and get that ballot, and you must send that application in order to get your ballot. The election is April the 28th, but you cannot pay attention to that date because this over by then. You have to make your request no later than April the 25th. I suggest that you do it right away. You can also go online and print out the ballot as well if you have access to a printer. We also are focusing on the census right now too. In our community, if we are not counted, we will not get the resources that we need. Resources for our schools. If you are wondering why our roads are so messed up, that's because we're not counted. For our schools, for our education, for everything in our community. So we must be counted. And it's very easy to be counted. You can actually go online and complete a form, or you can call, or you could call or go online. So it's very simple. So we are asking everyone to complete their census form, and that's happening right now, and voting is happening right now. We are always looking for new members because, as I said, our work is done on a voluntary basis. So we need help, and we need, freedom ain't free. Our work we're doing is free, but freedom ain't free. So we're encouraging people to become memberships. And we're also encouraging that everyone stays civically engaged. So once you vote, you don't disappear. You actually get involved, go to city council meetings, follow your elected officials to make sure they are doing the job that you elect them to do. So thank you for being here, and we're in the same boat. And we cannot ignore the CDC requirements. For so long, I believe that our community thought it didn't impact us, but everything impacts us, and it impacts us more so than any other group. So thanks again, Jan.
Thank you so much. And I was going to say, just to reiterate what Teresa just said to you, you do have to get the application for your absentee ballot. So you can call the Board of Elections at 632-7000, I think is the number. Renee's going to check and make sure that's right. The applications are in Kroger. They're in some newspapers. I'll put in a shameless plug for the Cincinnati Herald on page B3. So you can easily get those applications, mail it in, or drop it off at the Board of Elections so you can get your absentee ballot. And then, as Teresa said, get it in by April 27th at the latest.
Right.
Yeah, if you're
right.
mailing.
You have to request it before April the 25th. You have to get it before April 25th if you call.
All right, thank you so much. Okay, next let's go to Dr. Roosevelt Walker, who is president of the Cincinnati Medical Association, and those are all of our Black doctors, so important.
Good afternoon, everyone, and to the panelists and also to our moderator. And I wish to thank the Center for Closing the Health Gap for inviting us to participate on this panel. The Cincinnati Medical Association is the professional organization representing the African-American physicians and other underrepresented minority physicians who practice in the greater Cincinnati metropolitan area. Our focus is on two primary objectives. We serve as an advocate for minorities and disadvantaged populations in the Cincinnati community. We are working to improve the quality of healthcare for all of these disadvantaged communities. Our second focus, and one of the things that I want to inform our listeners is that the Cincinnati Medical Association has opened an Ask the Doctor link on the website of the COVID-19 Community Source program. And we have a team of physicians who are ready to take any questions that you have in regards to COVID-19. And we'll be more than happy to address those issues for you. So all you have to do is sign on to the website and send us your questions. Our second focus is functioning as the advocate for the minority physicians and other underrepresented minority physicians in Greater Cincinnati. And our focus with physicians now is increasing the number of underrepresented minority physicians here in Cincinnati. Cincinnati's population is 40% African American. However, only 2.1% of the physicians in Cincinnati are African American. So we are working with the University of Cincinnati's College of Medicine and also residency directors to develop a more inclusive process by which candidates for medical school and the residency programs are selected.
Okay, thank you so much, Dr. Walker. Okay, so Eric, you're next, and this is Eric Kearney, President of the African American Greater Cincinnati, Northern Kentucky African American Chamber of Commerce. And I was going to say it's already 4:20. We want to make sure we get to questions. So Eric, you're next, and then we'll have Renee, and then we'll move right into questions. We already have some coming up. Just to remind everybody that you can type in your questions on the Q&A. Okay.
Okay, thank you very much. I'll just go through this quickly. Want to thank everybody for including the African American Chamber. And it's really our honor to be associated with all of these great organizations. Just, I'm not going to go through this whole presentation, but wanted to tell you about some of the things that the African American Chamber is doing. We're working with others to provide relevant information. We're telling people through social media posts about supporting our businesses. We're providing programming virtually. So we're still open, much like the Urban League is open, but we're doing it virtually and remotely. So we can still offer programs. We have vibrant programs and also programs that are related to small business owners and their employees about how to work remotely, how to thrive in this type of environment. Our in-back office, which does certifications for the state of Ohio, is still open. We're still processing certifications, but we're also providing technical support for those people who are applying for loans. We're also doing videos almost every day, but every other day would probably be more accurate, that provide general business advice. We're doing well-being calls to all of our members to make sure that they're okay and to find out what they need. We're working with a diverse group of economic development and community organizations. We're sharing information about our members and what they're doing. And we're telling people how to apply for loans from the government, what that means, giving practical business tips about everything from asking for better terms to checking out your business insurance plans. And we're also asking people to look to the future. What will your business look like after this pandemic is over? Please try and reach out to any of our people and follow us on social media. Some of our social media channels are on the screen, and go to our website, african-americanchamber.com. So hopefully I did a good job in terms of time, Jan Michele.
Okay, great job.
Turn it back over to
Okay,
you.
thank you so much, Eric. And Dr. Odell Owens is on the call. Dr. Odell Owens, as you know, is president of Interact for Health. Dr. Owens, if you would give us a quick 2-minute intro about whatever comments you'd like to make, and then we'll get to Renee and then quickly to the questions.
Yeah, well, thank you for having me on the panel. But very quickly, Interact for Health tries to fill the gaps. When the city of Cincinnati
Do we have a connection problem? Okay, let's get back to Dr. Owens.
be able to screen patients who maybe could just use a prescription or antibiotic, because we have children and people who need that service, because they did not want patients with dental problems going to the emergency room. We've also provided thermal thermometers to the police department and fire stations so they can screen their officers before they go out into the field. We mainly have worked on trying to educate people. In fact, yesterday, Eric was part of a group that we cut, and Commissioner Moore, we cut a commercial telling African Americans and other people to stay home, to stay safe. So we're trying to be more of the education. The other piece we want to do is, the one thing I really pushed and have conversation with the Inquirer, in fact, just last Sunday, is that I don't want them to forget about the opioid epidemic. This is a problem where they'll focus on just the coronavirus, but no one's talking about the epidemic we have with drugs. And what is happening is that the drugs aren't coming in from China or Mexico yet. When they do, they're going to flood the market. It's going to be cheap, and we're going to go backwards and lose all the momentum and gains that we've had for the past year.
All right, thank you very much. Renee Mahaffey Harris, president of the Center for Closing the Health Gap.
Well, thank you everyone for joining. It is really an honor to be able to be a part of this conversation. And I think that we should thank each of us and the entire community for us really beginning to work together around this very serious issue of the health disparities that are impacting us. Yes, we are hearing articles and we're hearing stories and lots of data that are telling us that we are disproportionately impacted by the coronavirus due to underlying factors that have existed and persisted in our country for decades and centuries. As we know, since 1985, the conversation on health disparities and the research told us that despite or in spite of socioeconomic or educational factors, we have a disproportionate impact of incidence of disease as well as mortality of most diseases. But I think what's really encouraging me right now is that as you keep hearing about underlying factors, we are now walking outside. We are learning from each other as we're staying at home in place, information on how to eat healthy, how to read food labels. The Health Gap is doing a stay-at-home challenge and continuing to push out educational information through many of our partners like the Cincinnati Recreation Commission and many others. And this website really affords us a great opportunity to be able to, in one place, address jobs, emergency resource needs, COVID-19 questions and concerns, the Ask the Doctor feature, unemployment and how to apply, advocacy from, what questions that you can ask, what advocacy you should be able to have for yourself as you are talking to a physician or talking to a hospital or even talking with a landlord or any legal matters. So I would encourage people to please upload information. We are doing this for us. It's about us, for us, and together we are going to be able to combat and address all of the needs and concerns that each of us are experiencing in our community. And I hope that we will continue to talk together and share information on COVID-19, communityresources.com.
All right, thank you so much. Okay, now it's your turn. So remember, you can go to the tab Q&A, type in your question. We have some that have already come in. The first question was for Eddie Cohen, and it wants to know, does the Urban League have anything in place to help barbers and hairdressers?
Yes, as a matter of fact, I was helping a barber through their application late last night. Yes, we do through our business and entrepreneurship shop. The quickest way is texting Urban League to 797979. Once you subscribe there, we will get those messages. We help with loan packaging and walking through the process. One of the biggest myths that we've seen is folks saying, I have bad credit, therefore I cannot apply for a loan. SBA has 4 loan packaging. The most popular one is the Paycheck Protection Program, and the emergency loan is the other one that folks are talking about. There's 2 other products, and then there are 2 additional products for entrepreneurs. So please text that message. I will have Charlotte or Wanda. Most people don't know the Small Business Development Center is actually housed at Urban League, so happy to help.
Thank you so much. And that question was from Iris. Iris, thank you for that question.
Hey, Iris.
The next question is for Dr. Melba Moore. And it says, I don't have a primary care physician, so I don't have anyone to call. Should I just go to the hospital if I have a fever and dry cough?
Great question. No, a couple of things. Then we want you to be our patient in one of our primary care centers. We have 6 primary care centers. I'm going to share a telephone number that will kind of guide you through what I want you to do. Call area code 513-357-7462, 357-7462. And that number will link you to a nurse. And that nurse will ask you a series of questions. Have you had a temperature? Have you had fever-reducing medication? Have you taken it? When did you take it? And they'll ask you questions about that dry cough as well. We don't want you to just show up at the emergency room. What we will do is if you meet the criteria and you're exhibiting symptoms, then you can get tested. And what we will do is walk you through that process of where we will tell you to go or get you in to one of our health centers, not today, but on Monday. But we'll walk you through the process to get you connected. If we can get you into a doc's office today, or get you connected in our health center and get you signed up to have primary care services through our health center and get you tested.
Okay, thank you very much. This next question is directed to Dr. Owens, and it says, what's the problem with getting everyone tested?
Well, there's just not enough tests. Just not enough tests and not enough reagents. In fact, Quest Lab has 160,000 tests that's been done, but has not been processed because of the reagents. And when you have a pandemic, that means that every country, every major city in the world are after the same materials as we are, from the personal protection to the testing. There's just basically not enough tests. But it is sad that a lion in the Bronx Zoo can get a test and Black people in Cincinnati can't.
Mm-hmm. And Dr. Owens, when you said a reagent, is that what they put in the blood to see if the person has COVID-19?
No, the reagents are, when you do a test, you take a nasal swab, but then you have to process that. You wash it off in a test tube and you add reagents to it so you can measure and be able to identify the virus. And the most labs are lacking the reagents. There's two parts to that. It's the test kit, that's just wiping your nose, but you got to process it. So the chemicals used to process it is just in short supply as the nasal swabs themselves.
Okay, all right, thank you very much. There's another question, and this one is directed to Dr. Walker. And it says, is it true that drinking warm water stops you from getting the virus? And what about all this other stuff we're hearing on the internet?
The answer to that question is no, no, no. The things that we know that protect you from contracting the infection are, number one, stay home. Stay away from other people. Number two, if you have to go out, you should only go out to go to the grocery store or to pick up prescriptions or to see a relative who needs help. Number three, wash your hands frequently, wear a mask, stay 6 feet away from everybody, and wipe off all surfaces that are touched frequently. But water does not protect you from the coronavirus. We don't know of anything right now that protects you from the coronavirus except the social distancing regulations that we have issued.
Okay, thank you.
Thank you
this
for
question. Yeah, this question is not directed to anyone in particular. It's from Kellen Robinson, and she says, a biotech data firm found that an African American with symptoms like cough and fever was less likely to be given one of the scarce coronavirus tests. And then she says, what tactics can our community members use if facing racial bias discrimination when needing a diagnostic test? So can anyone feel that question?
Well, I'll take it on. Certainly, that's not unusual that we don't get a test. If you walk into an emergency room and you have early signs of a stroke, there's a drug in the emergency room that can lessen your chances of having permanent disability from that. Black people don't get it as often as white people. We have to speak up. And this is the time when this is on the table for all America to see about these discrepancies. So it's really about speaking up and demanding it. Hopefully you have a family physician who's going to be your advocate. That's why you need to have a medical home.
Okay, all right, thank you very much. This next question is for Teresa Harper of the NAACP, and it says, why is COVID-19 worse in the Black community? You know, this week we've had a lot of data. We're not surprised, but the data's coming out showing that, you know, Black folks are getting hit the hardest.
Well, it really shouldn't be a surprise, especially in the health community, because everything has always impacted our community more so. We've always had an epidemic in our community. This is just another one on top of that. We've have many of the underlying health conditions such as high blood pressure, diabetes, obesity, asthma, a lot of the policies that have existed forever in our communities have always been discriminative. You know, we tend to be more located in a food desert, so we don't have access to higher quality foods, healthy foods. We tend to be underemployed and also just under everything in our communities. And that's why it's very important that we don't pay attention to all the myths and the misinformation that's out there. This is a disease that doesn't discriminate. We're all in the same boat. We have to pay attention to the guidelines set by the CDC, social distancing, washing our hands, and taking care of ourselves. We have to do that. But this is not a big surprise because we have always had a big impact in our community when it comes to chronic diseases.
I would like to
I just
add
want to add,
Yeah, go ahead.
I would like to add to that response, if I may.
Please do.
And the answer to that question is really twofold. Number one, as African Americans, we have a higher rate of obesity, diabetes, hypertension, and asthma. And if you have those conditions already and you become infected, then there's a much higher risk that you're going to die from this disease. That's why it is so important to take the medications that you are prescribed and to follow the lifestyle changes that you are recommended in order to control those diseases. The other part of the question, the other answer to the question is that the African American and Latinx population is composed of a large number of members who are what we define as essential workers. And they are the people on the front line. They are the bus drivers. They work in the grocery stores. They work in restaurants. They and the people that work in barbershops and beauty shops. And they are working in crowded conditions where they did not necessarily have the type of personal protection equipment that they needed to prevent them from picking up the infections from the large crowds of people that they service every day. They also, and for those persons who are living in crowded communities where you don't have the space to really distance yourself or quarantine yourself from sometimes even other members of the family. So that's why this was such a ripe opportunity for the infection to become so rampant and so deadly in the African American community.
Thank you, Dr. Walker. I know Renee Mahaffey Harris wanted to weigh in on this too.
I just wanted to add really quickly, I think Ms. Harper and Dr. Walker have said a great deal. I think we need to just remember that the determinants of health and our quality of life factors are disparate, from jobs to transportation to our housing conditions, and you spoke to the density. And so all of these compounded factors, and now the light being shown on health disparities in this nation are an opportunity for us to really intensify the dialogue and conversation, as well as the advocacy to address the structural and systematic factors that are the reason we are disproportionately impacted by the coronavirus.
Okay, thank you very much. Our next question is from Donald Washington. So Mr. Washington, I'm gonna try to do you proud. It's kind of long. You're asking, you said, before the pandemic, our community was and is in need of having health insurance, primarily Medicaid, for many reasons. Now we are faced with our folks struggling to get access to health care because of not having insurance. Will this group commit to a collective effort to gain access to health care to keep us healthy? There is a lot in that question, but I hope you understand my point. Okay. Who wants to field that question from Donald Washington? Okay.
Offer an answer. The collective effort is that we have to vote. We have to elect politicians who represent our interests and are working to help us improve our lives.
Thank you very much. And then the next question is from Dr. Robin Ford. And Dr. Ford says, please emphasize that the digital divide and disproportionate impact on our community is real. Unfortunately, people are denying this. Yesterday, I did my first Zoom funeral service in New York City from here in Cincinnati. And then Dr. Ford says, thank you, and please educate us. We're very sorry about that, Dr. Ford. That's really tough. Does anybody want to comment? Okay. All right, Dr. Ford, thank you for that comment. That that really says it all right there.
Yeah, Jen,
Oh.
I'll jump in on the digital divide piece. So we have a partnership with PowerNet where we have wireless in Avondale for the community. I know that they are looking at other hotspots around Avondale, but even beyond. So the Spectrum deal is only for families that don't have internet. It's free for 60 days, especially with so many children that are out of school. Really critical. But for those of us who have the digital and technical literacy, what I would encourage is to partner and buddy with someone to show them how to use these applications and tools. It's one thing to do a wizard or something online, but to really get comfortable. In particular, we're having that issue with, one is to get our staff up to date and using technology, then the people who we serve who have limited data plans, limited phone minutes of how do we operate there. So it is a big policy issue. I think when we think about not only emergency service delivery, but these major issues, we have to collectively use our voice to say how we're going to advocate for folks. There are coalitions in cities like Chicago that are race-based coalitions specifically around the coronavirus. I think that time was 2 weeks ago, in which we should do that. We do not have to wait for someone to form that. This group and other groups, I know that Damon Lynch and Iris, they have a group that talks Wednesday. I think the time is now for us to really build that coalition of the willing to say what are our demands. And when we get testing, I know Dr. Owens talked about that earlier, where will those centers be located so we won't continue to see this disparate impact?
Thank you. And thank you for mentioning Dr. Lynch and Iris Rowley's group. They've started a racial equity task force, and they do have community conversations on Wednesday. I spoke to Iris earlier, and she's going to make sure we get that information on the COVID-19 communityresources.com website so everybody can link in there. The conversations are Wednesday at 4 p.m. So thank you so much, Mr. Cohen, for mentioning that. Dr. Owens, were you about to make a comment? No?
No, I'll wait. No, go ahead.
Okay. All right. So the next question is from Neilani Robinson. And Neilani asked, how can we prepare for a future pandemic? That's a really good question. What structural and systematic problems should be addressed so that our community isn't disproportionately impacted as it is now?
Well, first I'll say we don't prepare in our community for the regular flu. You know, we're talking about the pandemic, but as many of you may not know, 48,000 people died last year of the regular flu, and half the people who are eligible actually got the flu vaccination. So the first thing we got to do is protect the community against the regular flu. Most flus that we're seeing come from what? From animals. This flu came from a bat. But again, I think when Renee talked about all of these social disparities, we got to start with that first. That's going to be our best way to prepare for anything, is to deal with the social determinants of health.
Right. Thank you very much. Here's a question from Chelsea. Chelsea's got a long one. So Chelsea, I'm going to try to do you proud too. From the call a couple of days ago with BET President and Nancy Pelosi, there was a call to action for community business leaders and entrepreneurs to collectively petition our state legislators to expand resource access. She says there are insufficient funds going to minority communities, and they do not extend to them due to the fact that many minorities do not have well-established relationships with banks. What is a collective plan of action as we as city leaders will pursue to urge congressional leaders and all leaders to make funds and health access equitable? Eric, I know you want to weigh in on this.
can I jump in real quick? There are a couple of things that we're doing. One is we're holding some town halls with elected officials. We had one last week with U.S. Senator Sherrod Brown. We're going to have another one in the coming week with the state of Ohio, LG Husted. And so we're out advocating with these elected officials at the state and federal level for small businesses. You are absolutely right when you say that the resources that have been distributed by the federal government thus far have not come to our businesses in an equitable or proportionate fashion. We're working very hard to hold people's feet to the fire and make them accountable. The more stories that we get, the more data that we gather, the stronger our argument will be. So I ask that you share your story if you know of a business who, for instance, applied, got less money than they were told. We've heard a lot of stories about the delay. Some people were promised 3 days and it's been 2 weeks. So there are a lot of concerns there, and we definitely want to hear it, and we're trying to collect that data in order to be responsive.
Thank you, Eric. I wanted to just weigh in on that one. I had a phone conference with the Congressional Black Caucus last week, and I was pointing out to them that we just found out that people who had a felony on their record that was, I guess, more than 5 years old weren't eligible for these funds, like for the Paycheck Protection Program, things like that. And, you know, there are a lot of people here, they serve their time, they've got legitimate businesses going, they've got people employed, and now need help like everybody else and can't get those funds. So the CBC members were saying they just found out about that problem. They hadn't realized before, and they are moving forward and working on it. And they're going to get back to us this week with what the plan is. So, you know, we'll also have more information about that. I have a question here from Robert Killens Jr. And Robert says, why are men, and this might be a question for Dr. Melba Moore, why are men in most cases dying at higher rates than women?
A good question. And as we've talked about health disparities, we also understand that men, frequently more so than not, do not access their healthcare system. Health disparities, not accessing healthcare system, not seeing a provider, not having insurance coverage, it is a compounding effect that has happened. Women tend, it seems as if our systems are more structured towards women's health. There's been more of a movement to change that, in having men identified in programs to push that message forward, to educate the fear of going to the doctor, fear of what's going to happen. But I think fundamentally, part of that fear comes from past practices that have occurred as it relates to research of African Americans, as it relates to syphilis and what happened, and just the disparity there. But I believe their voices aren't being heard. And this is the second part to the question that you just had, that this is unprecedented times that we're in. And this is going across the entire racial spectrum. So African Americans are being greatly impacted, but everyone else, everyone in this country is being impacted by this pandemic. And we have frontline people who do not have the essentials of what they need. And this is the most pivotal time in our history that we're gonna have to stand up and act in a way to help our leadership understand and to push that envelope. Because this is having tremendous economic impact across this country. People who have money are being impacted. And this is the time where our actions are going to have to outweigh and be louder than our voices. And we're gonna have to push.
I love that, Dr. Moore. Our actions have to be louder than our voices. That is right. This is the time for action. Thank you so much for those comments. This next one, this is a comment, not a question, from Janie Allen Blue, and you know she is in the healthcare industry. Janie Allen Blue says, I am so happy to hear Dr. Owens talk about us speaking up and being assertive in an effort to get what we so deserve. We all need to assure that our family members and friends have advocates that can speak up and help us get the help and medical care we need now and beyond this pandemic. That's a great comment.
Hey, Michelle, can I add to that? I think that we've all talked about advocacy as kind of a group of people and organizations, but I think our individual advocacy is extremely important. And you need to know what your rights are. You need to know what questions you can ask when you aren't given the same equal treatment as someone else in a system. And someone asked, what 3 things can we do to address disparities? One, know the information and, you know, encourage you to visit the COVID-19 site, but also to look at videos, look at information, listen to people ask questions, hold accountable the people that you're electing to help get information, either at a local level or state level or federal level. And then ultimately, make sure that you are looking out for someone else. So if we each talk to a neighbor or called 1 to 5 people to say, how are you doing? What do you need? The needs are much greater than are being reported. When you see seniors who don't have Depends or who don't have cleaning supplies. However, they're living in systems that are federally supported. So we got a lot of advocacy and work we need to do together.
Thank you so much. I want to point out that most of you know Jason Dunn, and he's out now working with the hotel folks to see if there are items, personal care items, they can actually donate. So we're looking forward to hearing more from Jason. And Jason, I don't know if you're on this call or not, but thank you for that. So here's a question from Drs. Denise and Kevin Davis, and I'm smiling because they delivered my daughter. So always glad to hear from them. And their question is, does the Cincinnati community have a sufficient number of hospital beds and ventilators? Great question.
At this point, from the latest information that we have, because of improved the risks for our citizens, and we have been following the guidelines that are coming from the Ohio Department of Health, it is anticipated that the peak for us will not be as high as it was initially predicted. And if we can continue to follow those guidelines and have this impact, then from the latest report, the number of beds in Cincinnati will be enough to handle the peak as it's predicted to be right now. And that's the reason why it's so important to continue doing the things that we're doing now.
Thank you, Dr. Walker. I was going to say,
but Jan, may I just say something? But Jan, that's based on people in our community not gathering. You know, the police department is going around the city playing what they call putting out one fire then another fire of groups of 25 to 50 African Americans who are saying, I can't get the virus. And I discovered this is happening all across the country. I had a conversation with people in Detroit. Again, somehow we think we're invincible, but this is going to cause the second peak. We're going to worry about that second peak, and there will be a second peak.
Okay, thank you very much. I was going to say also, Patrick Dehaney, our city manager, has told us that Duke Energy Convention Center is prepared to have extra beds, I think up to 500 extra beds if needed. I don't think it's predicted at this point that we'll actually need that many. Ventilators, I'm not sure about. Dr. Moore, do you know how we're doing with the ventilators?
No, I'll have to punt that question to Dr. Roosevelt if he is aware. But to the point that was raised about the bed space, it's estimated that there's 5,600 beds in the region. And yes, to that point that it hasn't peaked as we anticipated. But again, I just want to remind everyone, let's not let our guard down. Let's continue to follow through with the social distancing. We know you're getting restless being inside. I know, Eric, you're restless being inside, but we want you to be with us. And I mean that sincerely. We want you to stay home, stay healthy, and stay alive. Put your mask on if you go outside, and take that walk and get back in. And just please be mindful of that. We don't know when the end. We've estimated and we've heard, and I'm sure the docs can chime in, that potentially that first week of May will peak. Maybe we will, but we'll have to see. But we must continue to do the same things that we've been doing with staying at home to help flatten that curve.
Yeah, and Jan, can I jump in here too? I think one of the things that cannot be ignored, because we always hear about African Americans congregating. One, I think the most infectious place in the United States is actually a ski resort in Idaho. So one, and then two, back to the opening thing that I mentioned, less than 1 in 6 African Americans can work from home. We're seeing pictures of folks who still have to use public transportation, who do not have the social capital or the privilege to social distance, right? So I'm very concerned with what I'm hearing right now of saying that the numbers are not as high as we expected. And as Odell mentioned earlier, Dr. Odell, we know that there will be a latent effect. And when there's a latent effect and something becomes a Black disease, then all of a sudden there's less attention, there's less spotlight, people don't care about it. So what can we do as a coalition? We're talking about lack of supplies in hospitals, but what does it mean if we say every person in Bond Hill or Avondale will have a reusable mask? That's something that we can do. We can have a fundraising drive to make sure that folks who have to be proximate and close to each other have equipment. We're happy to form a coalition to do that. We've already been thinking about how can we partner with Interact for Health? How can we partner with the Chamber just to make sure our community is insulated? And again, I really want to be cautious about looking at the numbers and saying that there's a downtick. We know we're not even testing everyone and that people are asymptomatic, right? So I don't want to really caution us not to celebrate. I'm not trying to scare people, but we've seen this happen with HIV and AIDS.
Right.
We've seen this happen with other diseases and pandemics in the community, so we have to remain vigilant.
Okay, thank you for those comments. Very important. I was going to say too, this will be a topic for another time, but another time soon. There are social gatherings of young people, but I think some of the young African American in our community are feeling like they're getting police attention where some of the white gatherings aren't. We've had complaints about some of the UC students playing beer pong and gathering for that, and no one's showing up to stop them. But there's a party in OTR and people are showing up to stop them. We don't want any of those gatherings. We're not supporting any of that. But I think the issue is we want to make sure that there's not disparate treatment there too. But of course, that's another conversation. We might talk about that next week. Okay.
Can I jump in? I just want to jump in a second, just on Eddie's comment. One of the challenges that we have is communication as well. And so we, when you mention Bond Hill or say Avondale or any neighborhood that we might really figure out a way to make sure people have gloves and have masks, we need to make sure we have a really effective means of collecting that information, because not everyone has access to internet, not everyone has access to social media, and have limitations due to phone plans. So we need to work collectively together with all of the media outlets to make sure that we can get those questions out there and get the responses back so we can meet the needs.
Okay, thank you. Now there's another question here. This is from someone, they called themselves an anonymous attendee, and that's okay. And we've kind of talked about this, but someone else might want to weigh in a little bit more. The question is, what can we do to emphasize the importance of this pandemic on our young adults? How do we keep them safe, engaged, and at home? And I would say especially for young adults who live places where there's no air conditioning and it's about to get hot, what do we do? Does anybody want to weigh in on that?
I think one of the best messages would be having young people deliver the message to other young people. And so I would, the anonymous person, if you are, you or others are willing to, record a video and get messages out through either the Herald or Radio One and all the stations, I think young people need to speak to young people and emphasize that urgency. And we're happy to help make that a more feasible opportunity on the radio and other places as well.
Absolutely, Brene. Amen. We just learned how to use TikTok. I didn't know what it was. Dancing, trying to find creative ways to reach out to our youth. And look, let's not fool ourselves. We know that there's a lack of trust between institutions and Black people and our youth. Let's not completely put the culpability on young folks and reckless behavior. We know that this disease, when it was first out, this virus, it's only for elderly people, and young folks are immune, right? And then you have 5G conspiracies out there. You have that it doesn't exist, right? So there's a lot of confusion. Us being responsible as an organization and adults is just to not cast aspersions. We actually reached out to the brother who was on CNN that was saying F the coronavirus. We could have used that opportunity, that same voice, because he reaches out to folks that the Urban League may not have access to, right? And so what a redemptive story if we could have said, will you do a campaign with me about the coronavirus? We cannot look at our work as usual, that we're going to go back to business as usual in 2 to 3 months. We have to look at guerrilla tactics, new ways to really aggressively reach out to our community. So Renee, absolutely. Youth has to be centered around how do you reach them, what is significant and what's important to them, and just ready to work.
Well, I mean, and also, Eddie, to add to that, we always have to meet people where they are. And so sometimes we may look at something from our own perspective, but there are a lot of barriers. And we must collectively figure out how to address those barriers and not wait for someone else to do it for us. And that's one of the reasons I, really applaud everyone being together and all of the different groups that are working to address the inequities that persist and how we can do something about it ourselves.
Yeah, I know one of our partners, Public Medical, is on this call, and they just did a video, 6 feet, mask up, and they're inviting other people to come in and join the video and post it. So you can go to COVID19communityresources.com, and you'll see how you can do your own 6 feet, mask up video and post that. So that's going to be a really, kind of fun thing to do that's also educational. I know we're at 5 o'clock. There are just a few more questions that I want to get answered real quickly. If everybody can give us just a few more minutes. This question is from Nicole Taylor, and she says, with African Americans dying at a higher rate from COVID-19, if a loved one becomes ill, how can families ensure that their loved ones are receiving adequate care if they're not allowed to be there by their side? And she's asking Dr. Owens and Dr. Walker to answer that question.
You can answer, Dr. Owens.
Well, I'll start. Well, I currently don't see patients, but again, I think we're fortunate that we are in a system. We live in a system of hospitals that I think the quality of care is good. And you're right, you can't be there when they're hospitalized, especially when they're in intensive care and on a respirator. We have to trust the system in the sense that in delivering medicine, once you get through the door, still doesn't always mean that African Americans are treated right. There was a study out of Harvard looking at just putting the IVs into sick people who come in, elderly people come in with pneumonia, and the Black patients didn't get their IVs put in as fast as whites. Mm-hmm. So I think what you have to still do, you can't go there, but you can call. You can certainly call. And I saw a program today where people are putting a laptop in the room of their loved one. So, and the laptop is one that stays on, there's an app that stays on, and they can communicate for those that are on a respirator with their families at all times. So we got to be inventive.
That's excellent. Thank you. Here's a question from Robert Bell. And he says, our emergency management, public health, and police and safety departments are working to respond to COVID-19. What would you like to see more of from Hamilton County to help this African American community effort? Well, that's a big question.
Thank you for that question. What I have seen, and as you all know, I've been here a year and some months, but what I have seen is more collaboration. I've seen readiness, quick readiness, steadfast readiness, leaning in. I think the one thing we seem to all be, the health jurisdictions are singing the same song as relate on the same page in saying what we need, and we need it now. You know, there are lessons learned from this. We know that one of the things that's so frustrating is trying to get the information out quickly and timely so people have it and understand what those numbers mean. And sometimes if you report you had a number of cases in the morning and then it looks like the number changes in the afternoon, and that's because that case is moved to another jurisdiction. So it's very challenging. I think one of the things that's most challenging for my staff from an internal perspective is that we're having to go back and really go through all of those positive cases that the race is unknown. That's very frustrating. I know people wanted that information and we started working on it Sunday, and it just ate up a lot of time, you know, and on the other side of that, I can only imagine that those submitters, as they're seeing patients come in, the time span, they're trying to move quickly and getting them in, and that information isn't charted. So, and that's been what I understood to be something that has been ongoing, and we need to do a better job at that. And it's not pointing fingers at anyone. It's just some of the things that we've recognized, and that the race element, that information is so important to help people understand what are the true numbers, and having a conversation about looking at the total number of deaths that we had. None of us wanted to see any deaths, none. And every day it's that knot in the bottom of your stomach, because I know when I open up those that numbers, I'm gonna see something that I'm not really happy to see. And today we have 4 deaths, you know, and those are precious lives that were here yesterday and the day before and the day before that. So it weighs on you to have to report this information out, to see it, to know that each count is a person. Right. So what I'm seeing is collectively people are working together, the city, the county. Yes, we need more PPE. Yes, if we could wave our magic wand, it would be testing for everybody. But what we've put in place, I just want people to, let's go with this. Let's be vigilant and being conscious about this, and then follow up with what Ms. Harper said. Get your absentee ballot and vote. Let your voice be heard on what you want to see happen.
I have to jump in on that. Voting is the only thing that people hear, that our leaders hear. So the reason why we don't have a lot of things in our community is because we don't vote in our community as much as we should vote. Our numbers are very low in our community, so we have to vote. And if there are no absentee ballots, applications in Kroger's, just make a phone call. Call the Board of Election and ask for an application. But we have to use our voice, and our only voice is voting.
And once we vote, we must keep people accountable for representing our needs.
Absolutely.
Thank you.
So let's see. I think you just answered the question from Ms. Strawn about PP. Ms. Strawn, if we didn't, please type in and tell me you know we should go back to that question. But I think that one was covered. So Eric, the last question is for you, and it's, does the African American Chamber provide any help to help fill out these forms to get this federal and state money that everybody's talking about is available?
Yes, we provide technical assistance. You can call us at or 513-751-9900. You'll get a voicemail. Ask for Deborah Davis, and Deborah can provide you technical assistance with that. Also, I believe that the Urban League is also providing technical assistance. So, Eddie, I don't know your telephone number, but I think either organization can help you. We're helping people every day complete the applications and the loans, and we're calling banks on behalf of people and providing updates along those lines. So yes, in answer to your question, 513-751-9900, African-American Chamber.
Okay, Eddie, did you want to weigh in on the phone number to call for the Urban League?
Yes, just text Urban League to 7979. I think I can get with Eric after this, and we might be able to throw together a video too to reach more people faster around PPP. So look for some updates for that next week.
Okay, thank you so much. Okay, well, it's 10 after 5. I appreciate everybody hanging in there for an extra 10 minutes. I want to thank all the panelists. You all are wonderful. We appreciate you taking your Saturday afternoon to talk to our community and answer questions and give much needed information. We want to let people know there'll be another town hall meeting next Saturday at 4, and during the week, we will let you know who the panelists will be. I want to thank the Center for Closing the Health Gap for powering all this up and for getting us all together for the COVID-19 communityresources.com. I know a lot of our partners are watching today and they'll be on soon. So we want to thank all of you for partnering. Those who haven't partnered with us, you're welcome. Please come on. This is for everybody. This is for all of us.
Plug the website.
Together. The website is COVID-19 communityresources.com. Also, for anyone who is listening today who did not get their question answered, you can email closingthehealthgap.org. That's closingthehealthgap.org, or call 513-585-9872. That's 513-585-9872. And the conversation, we've got to keep talking, keep educating. As Public Medical said, 6 feet, mask up. Thank you, everybody. We'll see you next week.
Thank you. Thank you, Jan Michele.
Thank you.
Kearney.
Thank you.
Thank you.
Thank you.
Thank you all, panelists.
Bye-bye.
See you later.
Thank you all.